Hi, I'm Amy Toonstra. I'm a professor of physical therapy at Concordia University St. Paul in St. Paul, Minnesota. And on behalf of my co-investigator, Allison Gustavson, and our fellow researchers at the Veterans Affairs Hospital of Minneapolis, I would like to present our abstract titled Building and Sustaining Organizational Capacity for the Rehabilitation Profession to Support Long COVID Care. So PTs in the outpatient setting at the VA hospital who helped with this paper were working with patients experiencing non-COVID and recognized a different pattern of care required for these patients to be successful. And this primarily related to an increased need for higher frequency and longer duration over time of visits. And they recognized that these changes to both organizational and structural support for these patients was going to be required, which really spurred the conception of this paper. So we know that rehab providers play a critical role in COVID recovery in terms of evaluation, treatment, and management of long COVID sequelae. Current outpatient structures may lack the organizational capacity to treat a large volume of patients at the frequency and duration needed to manage this complex condition. So in our paper, we outline the challenges in organizational capacity to be able to scale long COVID care. We then present a logic model to provide a roadmap for enhancing organizational capacity to support long COVID rehab services. So we end the paper with a call to action. We feel that grassroots efforts by providers, staff, and leadership are needed to advocate for and help build organizational capacity to be able to provide timely, equitable, and higher quality care for patients experiencing long COVID. We hope you find this paper beneficial and would encourage you to reach out to the email provided on the manuscript if you have any questions or would like to discuss further.